Good morning and welcome back to CityLine. I've already started the interview with these two. This is our segment on one of my favorite organizations, Emergency Food Network, and a partnership that they have. Please join me in welcoming back the CEO of the Emergency Food Network, Michelle Douglas. Hello, my dear.
Hi, thanks so much for having me.
It's so great to have you. You are so busy. So when you take time to sit on the comfy couch, it's nothing but gratitude from this side of the room. You also brought with you this fabulous woman in this beautiful green shirt, Beth Johnson. Hi there.
Nice to see you.
Nice to see you too. You are the CEO of Coordinated Care, and you're going to be talking about the trouble, the good trouble that you guys have gotten into here. So Michelle, for people who don't know what the Emergency Food Network does for our community, please tell us.
Absolutely. So we act as the large-scale distribution center for Pierce County and the emergency response. And so what that looks like is we're in partnership with 75 plus food pantries and hot meal sites. And we do food for them in a couple different ways. So we have all of the federal food and commodities that come through. We have a food buying program, which we call our co-op buying program, where we focus on buying staples like rice and oats and pasta that we repack with volunteers, and then canned fruit and a vegetable and a protein, and just those core essentials you need to get through.
Yes.
We have our Mother Earth Farm, which is out in the Puyallup Valley, 8 acres out there. It's beautiful, and that grows about 85,000 pounds of the freshest, most organically grown produce you can imagine. So that's been a great program. And then we also do about 6,000 bags a year for the main breaks of the school year. So spring, fall, winter, and those go to the highest need kids in Pierce County at Clover Park and Tacoma Public Schools. Wow. And it's pretty staggering how many kids are currently on free and reduced lunch. It's close to 50% in Pierce County. So
I was going to say before COVID, I think it was like at 45 or 55%. And so thank God you guys are still providing those meals for those children. How has the need for food, speaking of this, been impacted by the pandemic and the economic conditions facing families today? Because it's rough out there.
It is really rough. I mean, I talk to people all the time that are like, well, the pandemic's over. And first off, the pandemic is not over for so many people, right? And we talked about that earlier today, long haul COVID, all of those kinds of things. We saw a really large increase in 2020. And then we were pretty grateful. Our numbers went down a little bit in 2021. But the last 3 months have been 100% increase over those numbers. So just staggering for us. And at the same time, it's a competing access because the amount of donated product and the amount of product available from the government has decreased rapidly, like over 30% in each category. So it's a competing access that is really challenging for our families that are seeing inflation and high rents and gas prices and all of that.
Exactly. So, facing eviction, unemployment, all of that, putting food on the table.
Absolutely.
How is your partnership with Coordinated Care unique? And then Beth, I'm going to talk with you about why EFN.
Sure. So, I mean, I would tell you that Coordinated Care is the epitome of what we would most want in a partner. So they're supporting us in so many different ways. They do funds, they do food, they have an incredible volunteer force that come out and do our break bag programs. They coordinate us with us on advocacy issues. They're just really an amazing kind of 360 partner that has looked at EFN and said, we want to be in with you, but in with you in all of the different ways possible. It's been very, very powerful for us.
Wow. Christmas came early with this.
It sure did.
Boy, it sure did. So Beth,
yes.
How does Coordinated Care's purpose connect with the work of EFN?
Yeah, it's really quite simple. Our purpose is really to improve the health of the community. And as a local health plan, we recognize that not only do we need to provide access to medical care for our members, but there's so many social issues that impact health. And you were just talking about so many of them. And certainly food insecurity and lack of nutritious food is impactful to health. And so particularly during the rise of the pandemic, we saw an increased need. And so we started a campaign at Coordinated Care with our employees called the Million Meal Campaign. And so we, through donations, through volunteer efforts, through working with partners like EFN, were able to provide 1.6 million meals in our first year. That has since grown in 2 years to almost 4 million meals. And so we're able to do that through our partnership with experts like Michelle and her team in how can we get to that distribution? How can we provide those additional needs for the distribution that EFN and like partners have throughout the state? And as Michelle said, monthly, it's always a great volunteer effort for the team to come down to EFN and do break bags and break down the additional food for distribution. So it's been a great partnership and meeting that mutual need in our community.
Gosh, you guys are like peanut butter and jelly. You were meant to go together.
Absolutely.
Absolutely. Beth, I've heard that you created a new benefit for your members that relates to healthy food. Tell me about Coordinated Care Harvest Bucks.
I would be happy to. So again, our team really took a look at what are the needs of our patient population. And one of the things that we noticed is one of the 3 unmet needs that our members voiced the most was lack of access to food. And so we were able to create a value-added benefit for our Medicaid program that Coordinated Care Harvest Bucks, which is a voucher prescription program for produce. And so like EFN and Michelle, there's a lot of bulk food, there's a lot of, and produce, but that is harder to come by. And so we had a partnership with the Department of Health here in Washington and Safeway stores. And so our members can take those vouchers that they either get from our community health workers, sometimes their physicians, and bring them to their local Safeway store for fresh, frozen, or canned fruits and vegetables. So it supplements. And those vouchers are $10 each, and they can get 10 of those per year. And so one of the things that also happened during this period was we had a pilot program with Lyft. And so Lyft was able to bring our members to the stores and be able to redeem their Coordinated Care Harvest Bucks, and also at the time get vaccines.
Wow!
And so there was great partnership in some of these ways that we were trying to address those social needs that impact health that is really important to healthy communities.
Wow, and we're showing a voucher here that, that people can use. And can you buy vouchers for people?
No, it's part, we make sure that the supply of them that we have goes to our members and through our providers, but we are certainly looking at ways that we can expand that program, and the Department of Health is someone that we're working with, as well as the Safeway Foundation.
That'll be on your next visit.
That'll be on our next visit. We'll tell you how much it's grown.
Knowing you two.
Yeah.
So, Michelle, what barriers do people typically encounter when trying to eat enough fruits and vegetables? And we ask this question because I think sometimes people think that fruit and vegetables are plentiful. Yeah. So what's your answer?
So, I mean, there's so many barriers to it, and Beth has mentioned some of them, and I would be remiss to not mention one of the ways that Coordinated Care helped us meet this need right away, which is during the start of COVID, we realized we had all of these people that couldn't get to food pantries, and so we started a home delivery program, and they gave us the initial seed money to begin that program.
Really?
Which was so powerful. You know, we had people... Overnight, we needed to change how we were delivering food across the community, and at the same time ramp up our services just so dramatically. And when we talk about barriers to fruit and vegetables, right, it's when we think about our unhoused neighbors, right, the huge barrier there, people being able to afford fruits and vegetables, and also just kind of in some ways being educated about fruits and vegetables.
Yes.
If we think about 80% of health outcomes being food and other services that are not medically related, not everybody knows like a carrot grows in the ground.
That's right. That's right.
So between that and just getting access to them, it's been a huge advantage, because also the people that use Coordinated Care are frequent members of the food pantry community.
Absolutely. You guys are embracing almost the same families, but in a more efficient way. Last minute here. What are some of the goals for EFN as we head into these last months of 2022 and into 23?
Yeah, what I would tell you, Amanda, is we want to finish strong. So We still need your support. In fact, we need your support more than we have at other times. As we see donations going down and government support going down, our community really needs the food and fun drives that we run in the last quarter of the year. We'd love for you to come to our events, Empty Bowls in November, Abundance, all of those things. But also just to think about how are you as an individual impacting the need of food in our community? Because everybody needs food in order to thrive, not just survive, but thrive.
Exactly, and that's what we're talking about. We're talking about helping people thrive, helping people fight illness, helping people recover.
Right.
And that only happens with healthy food. Thank you. Thank you. Wow, I'm surprised I didn't hear the worlds collide in Tacoma when you two got together. This is such a fantastic partnership. I'm looking forward to more activities between the two of you. And I just want to say thank you so much for taking care of us the way you do, feeding our souls, feeding our stomachs, and looking out for us and making sure that we have a healthy lifestyle, body, mind, and spirit. So thank you so much.
Thanks, Amanda.
Thank you for having us.
We have much more to come on CityLine. Remember I mentioned that brand new CEO from Pierce County AIDS Foundation? Mr. Ace is going to be in the house, and he has a lot to say. You don't want to miss that. We'll be right back after this quick break.